Hi, I am Ehren Bucholtz. I am Director of Undergraduate Programs at St. Louis College of Pharmacy, and welcome to this alumni webinar series webinar about our new majors that we are going to be, or that we are launching this fall at the college. We have a long history of educating students for pharmacy, over 150 years, and we have developed a number of courses, etc., that are not just for developing practicing pharmacists, but we realize that these are courses that fit with the general education of many of the types of majors that our students might be interested in. We have generally brought in students who are passionate about healthcare, and we're going to continue to be doing that. And we've kind of developed this perfect foundation where whether you're taking chemistry or biology in preparation for pharmacy, these are going to help our students to also see that there are other health-focused degrees that students can be taking. So what we've been trying to do is look at what our passions are, not just in terms of our students, but as well as our faculty, and what we can do to offer up the best education that we can beyond pharmacy. The undergraduate programs that we offer at the college now include Bachelor of Science degrees and Bachelor of Arts degrees. The Bachelor of Science degree options are Pharmaceutical Sciences, Pharmaceutical Chemistry, Biomedical Sciences, and the Bachelor of Arts are Medical Humanities and Global Health. I should mention that the differences between a Bachelor of Science and a Bachelor of Arts degree is in the types of credits that a student will take as they're earning their degrees. Traditionally, a Bachelor of Science will have a higher number of science-related courses, and a Bachelor of Arts will have more humanities and often will have language requirements. So what I'd like to do is take a few minutes for each of these degree options and kind of explain to you what these degrees are and where students might go with each of these degree options. So the Pharmaceutical Sciences is our integrated degree that leads to the PharmD. So this is a 7-year curriculum that the first 3 years are in preparation for entry into the P1 year of pharmacy. There are 81 credits that are required for entry into the pharmacy program, and those are included in the first 3 years of this curriculum. Then in the 4th year, the senior year or P1 year, students will then be taking coursework that is in the pharmacy program. Now, after that, there's 3 years of, there are three additional years in the PharmD program that would result in the PharmD. Now, students can choose to, at the end of their first 3 years, decide whether or not they want to continue on to the PharmD or earn the Bachelor of Science in Pharmaceutical Sciences. Now, we had previously called these degrees Health Humanities and Health Sciences, but with the new degree changes, what we wanted to do is really give a better idea of what that undergraduate degree was. And looking at what the coursework is in the degree, we thought that Pharmaceutical Science was a much more appropriate name for these two degrees. And now we have as our two emphases Health Humanities and Health Sciences. So there are some slight differences between these two programs. They are both Bachelor of Science degrees. They have a lot of science involved. The main differences between the Health Humanities and Health Sciences is in whether or not a student will take 2 semesters of physics or 1 semester of physics and some extra social and behavioral science or other humanities coursework. Now, we have found that this is an excellent degree for other pre-professional pathways that students may choose to go on. Students that have completed the Bachelor of Science in Health Sciences, which will now be the Pharmaceutical Sciences, emphasis Health Sciences, have gone on to medical school, osteopathic medical school, dental school. We have shown that we have an excellent reputation of preparing students for professional type degrees. I mean, we've been doing this for 150 years for the pharmacy profession, but this coursework and our preparation can allow students to have some other options. So students who may have other program paths that they'd like to go on can be very successful with our pharmaceutical sciences degree. The new degrees that we have, well, I'll start with pharmaceutical chemistry. This degree kind of comes from some conversations that I have had with students over a number of years. I'm a professor of organic chemistry here at the college. I'm actually trained in medicinal chemistry, and as I teach my organic chemistry coursework, I tend to put a lot of drug design type questions and other types of medicinal chemistry concepts into the class. And I found that a number of our students were really fascinated with the idea of drug design and synthesis, and found that they might want to have more opportunities to choose that as a career path and being more of a bench scientist. So we started talking about an undergraduate degree in pharmaceutical chemistry. This is a very foundational knowledge type degree for chemistry, but it also allows students to go into other areas. Now, what is unique about the chemistry program here is we've really designed this from the bottom up to make it something that students are going to be employable after college or be able to be successful in graduate school. So we wound up talking with some members of industry, the local American Chemical Society, and tried to develop coursework that is going to be perfect for students who are going to have a career in this industry. We have courses that are specific to pharmaceutical chemistry in the senior year. We also have two really neat semesters of project-based chemistry labs. And if you think about the chemistry training that a student traditionally gets, they will be working on a lab in relation to some of the coursework. And what we found was that our graduates need to be able to work on projects and be successful in industry right away or successful at graduate school. And so we've developed a project-based curriculum where students are going to take turns not only developing the science that they're going to be testing or studying, but also leading the project, so they get some project management experience as well. We also are really trying to give some unique offerings in terms of the chemistry electives, and two of the electives that fit into this program nicely are chem informatics and biotechnology. Of course, there's organic synthesis and spectroscopy, but what's unique to us is the idea that offering chem informatics for our students. There's also elective coursework that allows students to explore other areas. They can take more biology, history, behavioral science, literature. The program is very similar in the first year to the current pharmaceutical sciences degree. It starts to change in the second year, where students are going to be taking physics in their second year so that they can take physical chemistry in their junior year, and it kind of builds from there. But the chemistry faculty are very excited about this program and looking forward to being able to teach some students some of these aspects of drug design and synthesis. Another one of our new majors is biological sciences. And this is a degree that really focuses on the human body and understanding homeostasis. This is something that is critical for healthcare and the scientists and professionals who work in that area. This is going to be a degree that's going to be a gateway to other medical professions, and the prerequisite coursework in this degree fits with medical schools, dental schools, pharmacy, etc. I should mention that while the prerequisite coursework for pharmacy is built into this degree, this is not going to be a degree that is one where students will be able to complete the PharmD and this degree in 7 years. This is not an integrated degree. So if a student chooses to do the 4-year biomedical sciences degree and then go into pharmacy, they can do that. They will have all of the prerequisites for that. It's just not going to allow them to seamlessly move into the pharmacy program. So they will have to finish their senior year. But there is some overlap with the coursework. Now, coursework in this degree program have genetics and molecular biology. Molecular biology is in the P1 year of the PharmD program, but we have added an extra credit hour to that course so that students can delve in deeper. We have much more opportunity for biological application of chemistry and physics in this degree. Students will be taking 5 electives that are called advanced biology selectives. And that coursework can be related to biotechnology, immunology. The immunology course is going to be similar to the one that students take in the PharmD curriculum, except for there's an extra credit hour. We have a scientific ethics course, and we have some other physiology and cell biology and neuroscience courses that students can take as well. Once again, this is a degree that will allow for some flexibility. There's a number of electives that are built into it, so students could take some other coursework in history, behavioral science, literature, or chemistry, anything else that they might be interested in. Those were the Bachelor of Science degrees. The degrees that we have for the Bachelor of Arts degrees are Medical Humanities and Global Health. So let me talk a little bit about those degrees right now as well. Medical Humanities is an interesting degree that is built on the idea that we really have been training pharmacists from a liberal arts perspective for many years. And so we have much coursework in history, social behavioral sciences, healthcare communication that we've developed for our pharmacy program. But students may not want to focus as much on the biological or physical sciences aspect, but still want to work in the healthcare field in some way, shape, or form. So this allows students to have that more traditional humanities experience and really look at the human side of medicine. So the coursework in this degree is going to be very, very different. They're not going to be taking a lot of the chemistry or biology courses. But what's interesting is there's a number of electives that are available in this, such that if a student wanted to take those biological and physical science courses, they could. And what we are discussing now is the fact that a number of medical schools are really looking for a student who has a more humanities background, and this could potentially be an excellent pre-professional degree for students who want to go on to medical school. Now, there are 2 current emphases in the program. There's interdisciplinary studies and healthcare communication. The interdisciplinary studies really gives a broad-based background in coursework in history, psychology, sociology, as well as healthcare communication and some other communication courses. The healthcare communication emphasis is much more prescriptive, if you will, where there are a number of courses that students will be taking specifically to improve communication skills, as well as how to share information with patients in many types of forms, whether that's one-on-one communication or other media, paper or social or internet-based. So what's exciting about this is these are very broad-based liberal arts type degrees that allow students to individualize their program. What's unique about this particular program is that the students will be taking coursework in theory and research methods in their junior and senior years so that they can really build a portfolio of projects that they've worked on. And so if they do decide to go into graduate school for, say, public health or some other degrees, they really have that broad-based emphasis, the broad-based background, as well as how to do research in those fields. One of the things that we are really excited about looking forward to is leveraging the resources that we have in St. Louis, and we're looking to create internships with many of the organizations in the city, and trying to look at things that might be a little bit beyond the scope of what we have done at the college. So, for example, looking at internships through the History Museum in Forest Park. So these are some really unique ways that we're going to be able to expand our offering, building off of the success that we have with the humanities that we have at the college. The fourth new degree program that we have is Global Health. And Global Health is another degree that's very interdisciplinary. And it's an area that we really want to have students focus on study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. The idea is we want our students to get a broad base in both science and humanities so that they can work with potential non-governmental agencies, governmental agencies, whether domestic or abroad, to help with health equity and improve health outcomes from a systems perspective. The coursework in this degree focuses on public health, social sciences, economics, biology, including microbiology, and communication. This is another program where we are developing internships and service learning and hoping to expand on some of the work that we have done at the college for the study abroad programs that we have for the pharmacy students. So these students hopefully will be doing some work in some of the other countries that some of our PharmD students have been going in and working in. Another new area is we have a collaboration with the Goldfarb School of Nursing at Barnes Jewish College, where we are going to be offering the prerequisite courses at St. Louis College of Pharmacy to allow students to earn a Bachelor of Science degree in nursing through the Goldfarb School. There are two different paths that students can take with this. They can either do the 2+2 program, where they do 2 years of prerequisite courses and then finish 2 years at Goldfarb and earn their Bachelor of Science degree. There's also another program where they will earn a bachelor's degree with us, and then in one additional year, this is what Goldfarb calls their accelerated program, will earn the BSN with them. And so we are linking this with our medical humanities degree. This is our most broad-based degree to allow students to have as much flexibility as possible. Coursework for prerequisites in nursing include anatomy and physiology, microbiology, psychology, sociology, much of the same coursework that is required for pre-pharmacy. So we've been offering this coursework, and it gives us another opportunity to bring in a new type of student into our college and really work with this idea of interprofessionalism, where we are working with different types of medical professionals, or getting our students prepared to be able to do that. We have a few other partnerships that I will touch on here. We have some collaboration with Washington University with their occupational therapy and physical therapy programs. So a student can do a 3+2 or 3+3 degree with us, where they will do the first 3 years at the college and then either do a Master's of Science in Occupational Therapy at Washington University, or the clinical doctorate in occupational therapy at Washington University. This is another one that's linked with our medical humanities. So the first 3 years are through us, and coursework in the first year of the graduate program is kind of linked back to the major requirements for medical humanities, and students will earn their bachelor's degree with us and then their Master of Science or clinical doctorate with Washington University. We also have a new partnership with their physical therapy program, and it's a 4+3 Doctor of Physical Therapy degree. Any of our degrees can be linked with this. There are a number of prerequisites that are required for physical therapy that students either will be taking as part of the requirements of our current undergraduate degrees, or can pick up a few electives to broaden out what they have for those prerequisites. And what's nice about this is that we have 3 reserved spaces for our students who meet admissions criteria. So this is another exciting way that we're providing new opportunities for our students. We also have a collaboration with A.T. Still University's Missouri School of Dentistry and Oral Health, where we will have 3 dedicated interview slots for qualified applicants from our college. So students might major in pharmaceutical sciences, pharmaceutical chemistry, or biomedical sciences, any of those 3, and have the prerequisites, and if they have the qualifications, they will have the ability to interview at the dental school. So that concludes what I would like to talk about with these new degrees. I feel that I forgot to mention that there